I'm now going to pass it on to our next presenter, Selina Brudnicki at the University Health Network in Toronto, Canada. Take it away, Selina.
All right. Well, thank you very much, Liz. And thank you for the invitation to discuss OpenNotes Lessons from Canada. You know, I'll never forget the time when I presented to a committee of medical leads at Princess Margaret Cancer Centre here in Toronto. My colleagues and I had been collaborating with over 80 patients, caregivers, leaders, and frontline staff from across multiple specialty areas to plan, design, and build a new enterprise patient portal called myUHN. And at the time, we were looking for a few early adopter areas to roll out and evaluate this portal, which would enable patients with real-time access to their appointment schedules, as well as results, reports, and clinic notes made available to patients at the same time it became available to their care team. There was silence in the room. And what seemed to be the longest 8 seconds of my life, some physicians actually stepped forward. Days later, a colleague had said to me, Selina, one of your physician champions felt pressured to volunteer, and he expressed concerns to the committee. So to put it mildly, he does not want to participate. I think you should talk to him. So today you're going to hear about some strategies, successes, challenges, and some lessons learned related to patient real-time access to their medical record, including OpenNotes. Now, I'm going to take a few steps back and provide you with context about healthcare in Canada. Our healthcare is publicly funded. We have universal coverage for medically necessary healthcare services that are provided on the basis of need rather than the ability to pay. We have provincial and territorial governments that have most of the responsibility for delivering health and other social services. Our federal government is responsible for some delivery of services for certain groups of people. But similar to Sweden, healthcare is generally financed through taxes, but also revenues. Now, in some provinces, such as Alberta, there are coordinated provincial efforts to provide a single point of access to medical records to our care teams through a health information system, and also to citizens through one patient portal. But in other provinces, such as Ontario, we have a best of breed environment. It is possible that there may be a central provincial repository held by our provincial government that pulls the data together from many organizations and makes it available to the patient's care team, maybe even to patients themselves, but that data is in no way complete. 85% of our family practice physicians in Canada, 79% of our specialist physicians report using an electronic medical record, but only 22% of Canadians can actually access parts of their records electronically through different ways. So sadly, in Canada, we only have 4 healthcare organizations that are recognized by OpenNotes for sharing their notes with patients. These organizations are focused in the Ontario and Greater Toronto Area region. And you can see here that one of these organizations is University Health Network, or UHN. UHN is known as Canada's largest hospital-based research program. It includes Toronto General, Toronto Western Hospitals, Princess Margaret Cancer Centre, and Toronto Rehabilitation Institute. The organization specializes in cardiology, transplant, oncology, infectious diseases, and surgical innovations, among other specialty areas. We have about 1,200 inpatient beds. We see more than 1 million ambulatory visits per year. Now, you can actually see from this slide that UHN actually has a 16-year journey of patient portal experience. We've had implementations at research, pilot, and enterprise levels across all our patient populations. And historically, we have always released real-time results and reports for certain patient populations. But it wasn't until 2015 to 17 that our electronic results, reports, and notes, including our mental health notes, became available for patient access as part of our enterprise patient portal, myUHN. So in the early days of our project, we very quickly discovered that there were three main areas where patients and our clinicians were not on the same page. Clinicians were concerned about patient immediate access to their results and reports, especially the pathology results, and they felt patients should receive their information and potentially any bad news in person, so they recommended delays for some sensitive results and reports. They had concerns about patient access to their clinic notes, and especially the mental health notes. And there were concerns about what this would do to the patient-provider relationship, their workload, and also their call volumes. Now, on the other hand, what patients told us was that they wanted timely access to their online medical records because they were at the center of care and the one constant that was managing multiple provider relationships. So having their information would actually decrease their anxiety and mental stress of waiting. They would be able to process information, including any bad news, emotionally at home. And then having that access would actually help them better understand their condition, prepare for appointments, and actually take responsibility regarding their own health. So what many people don't realize is that in 1992, there was a well-known court case where the Canadian Supreme Court actually ruled that patients have the right to access their record, including all the information in the file, which the physician considered in administering advice or treatment. And in some provinces, such as Ontario, there is also additional privacy legislation in place that states, with limited exceptions, individuals do have the legal right to access and request correction of their own personal health information. So it was actually our providers that recognized that results, reports, as well as the notes are an essential part of decision making, and it followed that this information should be made available to the patient. So at UHN, we have a primary value: the needs of patients come first. And we did ask patients to prioritize their needs. So what they told us was that they wanted access to their appointment schedules and reminders. They wanted real-time access to results, reports, clinic notes. They wanted to navigate to trusted education sources, and they also wanted the ability to share their health records with others. So in 2015, this portal became available to patients in early adopter areas, and in 2017, we proceeded with an enterprise rollout. Now, patients also told us that it was important for them to access records from other organizations outside of UHN as part of continuity of care. So over the past few years, we also worked closely with our Ontario Health Government and so many individuals behind the scenes to review legal agreements, privacy, security standards, and we completed connections to the provincial data using interoperable standards. So as of August of this year, very recently, all patients using myUHN now have access to their provincial or Ontario lab results, including their COVID-19 results, from over 150 healthcare organizations, from community and public health labs, as soon as they become available in this provincial repository. What you'll see on the screen is that our one-year project evaluation actually showed that 94% of patients reported improved patient experience. They felt better prepared for appointments, they had improved management of care, improved communication with their care team, and they were better able to make decisions because of this transparency. Now below that graph, or this graph, you'll see that staff perceptions were a little bit lower. However, over the years, we actually have been seeing a significant change and increase in terms of communication and the perceptions about patients making decisions. Also interesting to note is that 10% of patients found out of date or incorrect information in their record. There was no significant impact on the Princess Margaret triage call volumes for a majority of the sites, but we did receive anecdotal feedback that some of the calls to the physician offices had increased. However, we did not have any pre or post data available. So year after year, when we ask patients, we continue to see that more than 9 out of 10 patients prefer real-time access. And what you see on your screen here, I think this quote summarizes the sentiments very well. The patient says, "I prefer to have my results right away, even if they may be worrisome, because I have a right to that information. I find it more worrisome to not have the information. And when I do feel worried about my ability to interpret the results, or when I don't know when, or when I don't know and I don't want to know until I consult my healthcare team, I simply don't look." Today, we actually have over 150,000 registered users. And before the pandemic, our registration rates were very steady. But post-pandemic, we have seen an uptick in the portal registration because patients and staff are being tested for COVID-19. I think this has highlighted what we really knew all along, that there is an urgency for patients to access their record right away. Their health information is critical for decision-making and continuity of care. And we also know how important it is to have a dedicated support team with patient engagement experience to provide ongoing change management, education, and support for our patients and our staff. So here are a few tips to consider about real-time release. At UHN, patients are accessing their information as it becomes final and available in the hospital's main electronic record. Information blocking of patients to their own data is by exception only. So similar to Sweden, it is based on bioethical reasons or legal reasons. And for us, these reasons must be documented in the health information system, which is audited on a monthly basis. Now, to date, no provider has blocked a patient from access. So here's some additional advice by some of our medical and other colleagues. First, explain to the patient what and why specific tests are being ordered, and prepare the patient for possible outcomes. Provide information about what to expect next. Second, accuracy of documentation is key. Double check the accuracy of your residents, fellows, medical students who dictate on the physician's behalf, and this would help to reduce the need to correct notes due to inaccuracy of dictation. And third, be sensitive to the patient, but do not omit or avoid important information that is relevant to their care. And finally, if you think a patient may become anxious, advise them to look at the results during or after their visit so you can remember and review results together, or so that they can remember what was said at the appointment. Now, remember the physician who felt pressured to volunteer? He actually became one of our early adopter physicians, and he actually became a great champion. a couple of months after go live, he said to me, Selina, you've convinced me. Feedback on the myUHN patient portal has been excellent. There is no going back. And since then, I'm happy to say that we continue to see some remarkable clinical teams who take the lead in partnering and having meaningful engagement with their patients. But admittedly, for a minority, some are still adjusting to the change. I'm just going to leave you with some final thoughts. Now that you have heard some strategies, successes, challenges, and lessons learned, I hope you can see that building a new paradigm of trust through patient immediate access to all of their medical records will empower patients like never before and improve that patient-provider relationship. There is no going back. Thank you.
Wow, thank you so much, Selina. Just to quickly comment, there's so much you said there at the end that was super relevant to what we're seeing here in the United States with some new public policies and federal rules going into effect around interoperability and information blocking of patient access to information.